I'm here today with Linda Macomber from National University, and Linda, you're a veteran of IT health conferences, but this is one of those rare occasions where you're getting to be a fly on the wall and take in the event as opposed to being a speaker. So what have you heard so far that has kind of intrigued you or excited you?
Well, it's wonderful to be here. Thank you, Jim. I think that just the entire HITLAB community is what is I think innovative in that it brings together so many different people from the different perspectives, and I think it is just so professionally done. Collaborations and connections just seem quite natural here. So it's just a real pleasure to be a part of it. And yes, I guess I have gone to conferences and spoken at many.
Just a few. Yeah.
Just a few over really the past 30 to 40 years. So it's interesting to see, looking back and then looking ahead as well.
Landscape is changing fast, though, it seems like, just especially in the last couple of years leading up to now, and then, you know, in the immediate future. I mean, we're hearing about new things all the time.
Yeah, I think, you know, on a minute-by-minute basis, it's, if anything, just the acceleration of innovation and just the dynamic nature of it. Yeah, I'm from San Diego, California, so yeah, it does seem like the tectonic plates, everything is shifting.
Right. Well, here, this is my analogy, and tell me if this is off base a little bit, but back in the old days, you know, a patient would go see a doctor, and a doctor would treat the patient and send that patient on their way. And then we added specialists into the mix. And then we kept adding layers onto the healthcare system where it's become what it is right now. And it's not a pretty picture. And a lot of the innovations and new technologies are basically designed to return us to that system where the doctor and the patient are so much better connected again.
I mean, it's a very complex ecosystem, certainly, and you know, in terms of different work with startups, oftentimes it's helping them to figure out how to fit into that more complex ecosystem. But yeah, hopefully we return to the conversations with a physician and a patient, and to be able to return to conversation, I think, is one area that was discussed in the conference. I think that conversational AI enables some of that to happen. So enables kind of to free doctors and nurses from keyboards to be able to kind of get back to that human connection.
Heard a lot about that. And
yeah.
Described with relief from healthcare professionals.
Absolutely.
Yeah.
Yeah, they'd be able to focus a lot more on getting insights out. I like to think of AI as not artificial intelligence, but taking really more the actionable insights and to focus on the important decisions that you're making with your doctor, and to have that being empowered with the information to make the best decisions, and to have that be, you know, the medical libraries of the world and the journals of the world all being accessible, and then connecting that to really very personalized, very individualized care as being quality versus necessarily only following the protocols. And I think that's possible now, which is fantastic. I think from a care perspective. I started my career as an ICU nurse, and I always thought there was that kind of double dose of humanity for each dose of technology that you needed to be successful in that environment. And I think we're getting back to that, getting back to the humanity side of it, because the technology can be more helpful for us. And so, I mean, a lot of AI, yeah, I guess I've been involved with it since the 1980s. So we're speaking before about the different agents and how we've got all these helpers now with AI. Much of that was really envisioned by Marvin Minsky in the book The Society of Mind, which first got me excited about AI in the 1980s, and then really my career progressed towards a lot of clinical decision support systems and expert systems and connecting the dots of patient care, like you were saying, that the ecosystem has so much complexity. There's a need for a lot of connections,
Right.
and the technology can help us with that.
Right. A gentleman from Johnson & Johnson sat in the chair earlier today and was talking about agentive AI, something that's been out for basically 2 weeks.
Right.
And how this new form of AI can basically be a fresh team member for a healthcare professional, and they can actually match up more than one to make the team even bigger depending on the complexity of the case. And I mean, this is fascinating to me, and that it's more than interactive, and it's more than just the sifting and fetching of data. That there actually is some interplay. It's much more human in ways.
Yes, I think that the computers have become a lot easier to use. I mean, it's not like we need to learn to use computers as much because they are meeting us part way. And certainly the conversational AI, the ability to have every student has a tutor in their pocket, all of us have assistants that we just need to kind of tap that power to be able to use. So whether we call them agents or assistants, but just tapping the capabilities, that whether it be using different systems to really be a better doctor, be a better nurse, live longer, and it's not just about AI, it's about what we're doing with the AI that matters.
Right. But to do this, I mean, there are economics involved here.
Sure.
And they're a little bit complicated, and they're a little bit tight, and
absolutely.
I don't think that's been figured out completely yet.
Well, I think there's a cost to doing nothing, and that's often been the case with digital health. People look at the cost of the systems. I like to think of it much more as an investment, and that's true with technology, and it's true with AI. But I think we're at a historic juncture that it's very exciting to experience in my lifetime, because it was all science fiction more when I first was excited about it, and now it really is becoming something that is very helpful from the perspective, I mean, the cognitive load on physicians, on nurses. I think we can really hold on, it may really bring the care to us instead of us needing to physically go to the care as the ambulances were just taking off.
Yeah.
But I mean, what if we can truly use the virtual systems to heal at home? And so I think there were a lot of different sessions related to that. Instead of going to healthcare comes to you. And certainly there was a great deal with telehealth during the pandemic, but to have that objective information as well. So I think that there's just a connection of many different things coming together, one being the ability to have a lot more sensors, like they're really smart socks. I thought, that
was a cool idea.
There's some great ways to capture health information, but then there's too much. And so then that ends up putting a burden on physicians. So the AI paired with that gives you the ability to find the signal through the noise. And so the insights, so I like to think of actionable insights and insights that are something that we will make better decisions based on much better information that's much more specific to you. So that not only helps all of us, but certainly helps heal the healthcare system as well as healing us.
So as you look ahead in the not too distant future, where do you think most of the helpful innovations and breakthroughs will come from?
Well, I mean, the classic with 2 Nobel Prizes related to, in terms of the basic sciences. So I think drug discovery is certainly atop of the list. I think the ambient clinical intelligence to take some of that pressure off of getting the information into the system, and then the pairing of being able to pull the new insights I think oftentimes, people speak of medical errors, but it's sometimes the errors of omission. So much more proactive care because we have the information earlier to address it, whether it be a retinal scan to be able to identify things earlier. Certainly there were some conversations about scanning and early identification of cancer to where we can treat it. That just is a win-win for everyone.
Sure does sound like it. Linda,
Yes.
thanks for coming down and sharing some of your insights.
Well, thank you very
Hope-
much.
Hope you had fun at the conference.
It's fantastic.
Good deal.
Highly recommend for all to come to New York.
Good, good. Thanks.
Thanks.